Welcome to Skin of Color Savvy, the art and science of treating patients of color, the official podcast of the Skin of Color Society, produced by HCPLive. Hosted by SOX leaders, Skin of Color Savvy delves into the latest research, clinical insights, culturally intelligent and responsive practices, and other news important to treating patients of color. I'm Dr. Heather Woolery-Lloyd. I'm a board-certified dermatologist based in Miami and also director of the Skin of Color Division at the University of Miami. And I'm joined today by Dr. Aderonke Obayomi. Dr. Obayomi, please introduce yourself.
Hi, I'm so excited to be here today. My name is Dr. Aderonke Obayomi, and I'm a board-certified dermatologist and assistant professor at Mount Sinai Hospital in New York City. It is such an honor to be here today, and I'm especially excited to be the guest of Dr. Woolery-Lloyd as I trained under her at the University of Miami. So it's just such an honor to be here, and just thank you so much for having me.
Well, I'm so excited when I had the opportunity to host this podcast. You were the first person I thought of, especially because you lived in Miami and now you live in New York. So I thought, who knows more about winter skin than Dr. Obayomi? So I'm so excited that you're here today. And actually, that actually brings me to my first question was that, you practiced or you trained in Miami and then you moved to New York. So what kind of changes did you see in your patients when it came to winter skin?
Huge differences. So, just yesterday here in New York, it was snowing and it's November. So,
Oh my
I think
goodness.
such a big difference between, Miami and New York, and that dry skin here is really, it's much more severe. So, here I find that patients are having, patients who maybe have never really had eczema, they moved to New York, or maybe they've had eczema their whole lives. It's so much more dry and severe, and patients are really, it can be really debilitating for some people. They're constantly itching themselves, or their eczema is just so bad they can't sleep at night. So, I would say here the severity is, much more, it's a lot more. And there's definitely a lot
Right.
more patients who are, suffering from very dry skin, especially in the winter. And here in New York, it's a little bit different in a lot of ways. But a lot of people, they live in these apartments where we don't have control over our heating systems. And so it's
Right.
like in the middle of, October, September, all of a sudden your heat comes on and you can't change the temperature. And it is just blasting, 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 and making the air in your apartment even more dry. So this makes it even harder for you to, you don't really have as much control. And then the eczema flares up or the dryness becomes much worse.
So that's really an issue. I actually remember, so even though I've lived in Florida most of my life, I did go to college in DC, and I do remember when the air would or the heat would blast on. And I remember how dry the indoor air is, which is something that we don't think about. We think about winter skin and the wind blowing and like windburn and the dry skin from being outside. But it sounds like, and from my experience too, from the little period of time that I lived in a cold climate, that winter skin also has a lot to do with indoor dryness. It's a big problem.
It's
So do you have any clinical pearls? Like what do you tell your patients? What do you think about when, and I'm sure you've come up with many more since you've moved there because for the first 4 years of your career, you didn't really have to think about this so much.
Yeah, so absolutely. There were some things I had to, kind of think about a little bit more, do a little bit of research. Even my own personal self, I invested in a humidifier. So humidifier, game changer, because again, when you're in your apartment and all these spaces that the dry heat, a humidifier has really been a game changer. So this is an easy way, it doesn't have to be anything crazy expensive. You can go, buy like a cheap one. And this is something that can add moisture into, your air while you're sleeping. And this can really help with, really winter dry skin. Other key things are making sure that, you got to moisturize your body with a heavy cream, not
Right.
some lotions. We got to use creams because these are much thicker. So a lot of times patients really, maybe don't know the difference, but lotions are more water based and it's better to use like really thick creams. And the best time to moisturize your body is as soon as you come out of the shower. Now the shower,
Right.
even though it might be really chilly outside, we want to make sure that we're not doing too hot of showers, even though that might feel good. We want to, ideally be using kind of lukewarm water. And that's because using high hot temperature water, that's going to dry your skin out even more. So you want to keep the showers quick, lukewarm, and then as soon as you get out, don't even towel yourself off. You should put the thick cream moisturizer all over your entire body, head to toe. And even better is then to take some petrolatum, like, petroleum jelly, and put that on top because that helps to really seal the moisture into your skin.
I agree. I will say I was guilty of that when I did live in DC, and I would take the long hot showers because I was so cold. I'm such a Florida girl. I was so cold, and that was the only time of day that I felt warm. But of course, it destroys your skin, those long hot showers. So you're right, like really keeping it short, and most importantly, applying moisturizer immediately after you get out without even drying off, I think is key. And I think some people don't do that. So it definitely makes a difference.
And
Now, one
oh,
thing that, we think about when it comes to winter skin and dermatologic disease is the things that we constantly treat. Like we know eczema, for example, gets worse, right? In the winter, well, not necessarily, but for many patients, it can get worse. There are a subset of eczema patients that get worse in the summer because of the heat, humidity, and sweat. But in general, as the humidity drops, even in South Florida, as the humidity drops, we definitely see worsening of eczema. But I was looking at these studies. There's a couple of interesting studies I was thinking about with psoriasis and acne and other skin diseases. Do things get worse? And it ends up that for some people it does. So there was a study, it was looking at psoriasis patients, and they actually looked at 13 different studies that looked at whether there were seasonal variations in the severity of psoriasis. And it ends up that around 50% of psoriasis patients showed no seasonal difference, but 30% of patients improved in the summer, which means they were worse in the winter, and around 20% were improved in the winter but worse in the summer. So there is a subset of populations, like for psoriasis, for example, where their skin and their skin disease, their psoriasis gets worse in the winter. So have you seen that in your practice? Is that something that you've noticed, in the last couple of years?
yeah, I definitely would say that I do see that. And I think one of the, it makes sense that psoriasis would be a little bit better in the summertime because, one of the treatments we do for psoriasis is, UV light, right? So, typically in the summertime, of course, people are going on vacation, they're spending more time outside. So they're just getting natural treatment from just going outside. So it definitely makes sense that these studies would see that people's psoriasis would improve, during the summertime.
Yes, yeah. I think that it is interesting. I think also even psoriasis, just like anything, there is a barrier issue with psoriasis. So in the winter, as the humidity drops, the skin barrier becomes more compromised. I can understand why some patients might get worse in the winter. And so I wasn't surprised by that study. And then there was another study looking at acne patients, and it was kind of similar, but the breakdown was different. So a third of acne patients, this one was a survey of 139 acne patients. A third of acne patients, there was no change at all seasonally. A third got worse in the summer, and a third got worse in the winter. So with acne, it's a little more complicated. It's not as straightforward. Psoriasis, it does make more sense. Some patients do get worse in the winter, and it's just important for us to be aware of that.
I think it's also something to think about that, in the wintertime, there's also a lot of holidays and people are going to gather. And, sometimes these can also be stressful activities for people. So those are, stress is always something that can make really any kind of condition worse. So, I think in the winter or summer, especially in the wintertime, if you're going to be having all these activities and seeing people and going from holiday party to holiday party, that can definitely be stressful for people and cause these things to flare too.
That's true. I mean, definitely for acne, and we didn't talk about food, the high glycemic foods that we all consume during the holidays. So maybe that's why one third of acne patients get worse in the winter because our diet kind of goes downhill when in the winter, and we're definitely, eating more high glycemic, more sugar, more things that are definitely shown to be not beneficial for patients with acne. And of course, stress always makes acne worse. Stress makes all inflammatory diseases worse. We see that with psoriasis, with acne, with eczema, and for a lot of people, the holidays and the winter can be a little bit stressful. So that's a very good point. So now let's talk a little bit about skincare because you mentioned you want to switch from a lotion to a cream. And I find that even in sunny South Florida, even though we don't get a traditional winter, we do see this decrease in humidity over time. So in the winter, the humidity drops. And people who are used to having this high humid environment, people with dry skin, they find that their skin gets significantly drier in the winter, even in Florida, even though our temperatures aren't going down to 30 degrees, that change in humidity is just as important. So
Mhm.
when we think about skincare, I always recommend like a heavier cream or an ointment. Um, I know that when I lived up north, my hands would get very dry because you're taking gloves on and off. Do you give some tips for that for people with with just their body, dryness on the body, also on the face, but also on the body?
So honestly, you gotta reapply, reapply, reapply. So
Right.
I tell everyone, you gotta, in your bag, in your purse, whatever, you gotta carry around, some petrolatum with you. You gotta be, liberal with it. You can't, overdose on it. So I think it's a good idea to just always have that on hand. And we want to try and, use uh, lotions and creams that are for more sensitive skin. Because oftentimes, if you start getting a lot of things that have a lot of allergens, fragrances, all these things, these can be allergens that can irritate your skin further and actually dry you out more. So we want to try to make everything be as bland as possible. We want it to be, just like all for sensitive skin and thicker creams that are going to help kind of really rehydrate the skin.
Yes, I agree. I think that, you bring up a very good point about allergens, and that in general, ointments and heavier creams are less likely to have, specifically ointments, I guess, are less likely to have preservatives. So as people's barrier becomes more compromised, the heavier the product, the better. And I love that you can't overdose. That's a very good point. You can't put on too much. And we have to really emphasize that to our patients, because the only rate limiting step is cost. Basically, the more the better when it comes to moisturization in the winter. So, I was talking a little bit about Miami, and it brings up this very interesting point when it comes to natural moisturizing factor. So, I always tell my patients there's this soup of ingredients that are in our skin and our epidermis that helps to maintain the water balance in our epidermis, and that's the natural moisturizing factor. And the interesting thing about that is that they've shown in studies that when you go to a low humidity environment, the genes turn on and your natural moisturizing factors actually upregulate to pull more moisture in from the air, so you get more hydration. But it does take a while to acclimate. So I say, for example, when my family travels to somewhere like Colorado or somewhere very dry, we do see this significant change where our skin gets very dry, or my skin will get very dry. But if I were to stay there for several weeks, you do end up upregulating that NMF to pull in the moisture. So our skin is kind of dynamic. And with travel, you definitely see significant dryness when you go to low humidity environments. And in Miami in the winter, I see that in my patients. They do acclimate, but at the beginning of winter, when the humidity drops, I do see this uptick in patients with eczema, complaining of more dry skin, and they'll say, I don't know, my skin got dry out of the blue. And I always say, that's because of the drop in humidity, but it will get better when your NMF kind of upregulates, and also by using, moisturizers and lotions and all the things that we need to use. Now, I have a question for you. This is kind of interesting. So we know we have these winter related skin changes. We talked about more dryness and so forth. Do you think that it presents differently in your skin of color patients compared to your lighter skin patients?
Yeah, absolutely. That's something that's, very important. I think a lot of people, are unaware of this. So oftentimes when you think about lighter skin patients, we'll think about, if we think about eczema, it can be, very red, it can be, dry, scaling, that kind of thing. But oftentimes in, people with some more pigmented skin of color patients, eczema is, redness can be hard to see. It can be really hard to appreciate this. You need to really have a trained eye to understand, what sometimes the inflammation can look like. So sometimes the redness and darker skin tones can maybe look a little bit more purplish. It can look maybe even like grayish in color. So it's something, maybe ashen color. So those are things to really kind of be on the lookout and have a sharp eye for that. So the erythema may be a little bit harder to appreciate. Another key thing about especially, atopic dermatitis in skin of color patients is that oftentimes it can be more what we call follicular eczema. So it looks like almost little goosebumps on people's skin.
Right.
So this is something that I would say is more specific to skin of color, but sometimes can also, people can often miss that. And so that's
Right.
something to really be aware of with skin of color patients. And the other very important thing in all skin of color patients, hyperpigmentation, post-inflammatory hyperpigmentation. So anytime we have any kind of inflammation in our skin, in patients of color, we get post-inflammatory hyperpigmentation, basically, that it's a scar, that there was inflammation there. And then oftentimes this hyperpigmentation can be something that actually disturbs patients more, even more so than whatever the initial inflammatory condition was. But, the key thing is that we must treat the underlying cause of the inflammation first before you start just chasing the hyperpigmentation. Because otherwise, you're just going to be going in a circle. You're just going to be chasing,
Right.
you're not going to be doing anything. So especially, winter skin, we're talking about eczema, you have to treat the underlying eczema first before you just chase after the hyperpigmentation. Otherwise, you're not going to get anywhere.
Right. And the other thing I wanted to mention is that you talked a little bit about ashen skin, and culturally, our skin of color patients do not want to have quote unquote ashy skin, which is a big problem in the winter. Even if you don't have eczema, even if you have normal skin, almost everyone with darker skin, when their skin gets dry in the winter, that skin gets that gray kind of ashy look. And for many people, it's completely culturally unacceptable and is a big problem, a big concern. So that will hopefully drive our patients, even if the cosmetic appearance might drive our patients to use better moisturizers in the winter or heavier moisturizers in the winter. So now I want to talk a little bit about misconceptions. Let's talk a little bit about misconceptions in patients of color and what misconceptions they might have about moisturizers or sunscreen use in the winter.
So, something that is super common in patients of color is that oftentimes patients will come to me and they'll say, "Oh, I moisturize my skin every day. I'm, slathering on my coconut oil, my shea butter, my castor oil." They're using all of these, different things that maybe they've grown up with, or, these like more like home remedies. Sometimes patients will say they make it themselves, all these different things. And, I'm all for mixing together, proven things and then also, some alternative things as well. There's no problem with that. And many of these things smell nice and all of that. They make you shine. Great. However, many times these things are actually allergens, like we kind of talked about a little bit earlier, and it can actually make your skin more dry. It can make your skin
Right.
more dry. It can irritate you more, and it can just make things kind of worse. So, sometimes we need to put down the, all the different oils and all the different fragrances, essential oils. And I think we need to, again, try and go back to some of our, tried and true, sensitive skin, thicker creams.
Yeah, I agree. And I sometimes people add essential oils, so they'll make their own concoction and they think, okay, I'm making this great natural
Natural.
moisturizer.
Yes.
And then they'll add essential oils to it because they want it to smell good, but essential oils can sometimes be very aggravating. And the other thing people don't think about or talk about as much, essential oils sometimes have very strong phytoestrogens in that. So if you're adding, there's been studies or not studies, there's case reports, I should clarify that, of lavender oil and tea tree oil. Now, people probably wouldn't add tea tree oil, I would hope, not to a moisturizing oil or lotion, but definitely they would add lavender oil for the scent. And there have been case reports of lavender oil being associated with gynecomastia in
Wow.
children, in male children who were using it as a body lotion or using it all over their body in these types of natural things. And they actually did a study where they didn't do a study, but in this case, they withdrew the lavender oil moisturizer, and which was like a homemade lavender oil kind of emollient, I guess you would say. And the gynecomastia reversed.
Oh, wow.
So there are so many things. That's just, a case report, a couple, there was I think 3 cases that were reported, but there are other effects of sometimes these essential oils
Yeah.
beyond, the traditional irritation that we think about. So those homemade things, sometimes, I understand why people want to do them. And I don't want to say, oh, they're horrible, but people don't realize that they're not perfect. And the tried and true moisturizers that we recommend are much less likely to cause these types of issues. So
Yeah,
that you
exactly.
bring up a really good point. I never thought about all of the homemade concoctions that
I just
people
had a
do.
patient earlier today, like just a few hours ago, who, she's done patch testing, she's found she's allergic to all these things. And then I'm like, okay, we've been talking about, okay, you got to do all this sensitive skincare, please like walk me through what you're doing. And then she, then said, well, I put lavender oil in all of my stuff. And I said, well, here we go, so you have
Oh,
to be careful about things. Like, just like you said, just because all natural doesn't always
right.
mean that this is, that it's going to be safe for you.
Right. And then, of course, the sunscreen, I have to talk about sunscreen. I live in Florida, and people think, oh, sunscreen's just for the summer, for the beach, when I'm going on the boat. And even in the winter, especially our patients with hyperpigmentation, they might think, oh, it's a winter now. The sun isn't really out. It's gray out. I don't need to wear my sunscreen. But we know that UVA penetrates and it's a driver of pigmentation. So our patients really still need to use sunscreen, and our skin of color patients who primarily complain about hyperpigmentation should continue to use their sunscreen even in the winter,
You're
even though it seems like they don't need it, because that UVA, which penetrates the clouds, is really a driver of pigment
Mhm.
and
And
melanogenesis.
yes, and especially with the sunscreen year-round use, even if it is, raining, cloudy, because that's something a lot of New Yorkers tell me. It's like, oh, well, it's cloudy, it's rainy. No, the sun is always with us no matter where you are. Even if you are planning on staying, inside, even in your house, you have windows. So, the
Yes.
sun is still coming through. And especially for hyperpigmentation, we even know that, visible light is something that can also affect hyperpigmentation. And so, sunscreen,
Yes.
yes, very important, but even better to wear a tinted mineral sunscreen. Because
Yes.
tinted mineral sunscreens, they have iron oxide in them, which is an extra ingredient that's been shown to block against visible light, which makes hyperpigmentation worse.
Exactly. So those tinted sunscreens are something that I always recommend. And because I'm always treating pigment, that's something. And then I will mention one little thing, because tinted sunscreens, the reason why we use it is, as you mentioned, the iron oxides protect against visible light. There are some formulations for people who don't want to use a tinted sunscreen that adds antioxidants, and those antioxidants have been shown to help to protect against visible light too. So there are other options, but typically the easiest option is a tinted sunscreen, because iron oxides are the ones that really are the ones that are going to block the visible light. So we've talked about so much, and I don't know if there's any other tips. I'm trying to think about things that we may not have discussed, or any things that you talk to your patients about when it comes to winter skin. You sound like you've become a winter skin expert. Maybe it's because you are from the north, so I guess you're kind of used to it. But you trained in Miami, and you probably had to learn a bunch of new things when you had this new patient population, and that's experiencing winter. So any other tips that you want to offer?
Well, I would just say, less is more. But, of course, in this age, people are always looking to build their skincare routine. They want to have as many things as possible. So, another thing I think about is hyaluronic acid. So, hyaluronic acid is also a very popular ingredient that's popping up kind of in everything. And this is something that we call a humectant. So, this helps to retain water in the skin. And there was actually a study that showed that hyaluronic acid can increase skin hydration by 55%. So that is also another thing that if you're really struggling with dry skin, having a hyaluronic acid is something that can really help to with those extra stubborn spots. And hyaluronic acid has been shown to improve smoothness, plumping of the skin, hydration, fine lines, and wrinkles. So it does a little bit of everything. And it is
Yeah.
something that's safe in all skin tones and is something that is tolerated very well.
Yes, it is a great one, and it's one that our patients recognize the name. So if you recommend a moisturizer and say, and it has hyaluronic acid, they'll get excited. Oh, yeah, okay, that's good. You know, Same thing with ceramides. That's another hot topic. So you'll say, "Oh, this is a really good moisturizer, and it had ceramides," and they get really excited, like, "Okay, well, that's good." Anything to improve compliance is what works for me, even if it's because people are more interested in the ingredients than the actual product. So that's a really good point. I think now there's sometimes in skincare for facial skincare, people will say, "Oh, when you put hyaluronic acid, you should put like an occlusive or an emollient on top to seal it in." And I do think that's true with like a hyaluronic acid serum. So when for facial skincare, I will recommend that. For a moisturizer, they usually have emollients or occlusives in there, so you don't probably have to layer something else on top. But that's something that people will sometimes ask about. I think that we have covered everything. And I have basically one last question. Do you
All right.
have one key takeaway you'd like dermatologists and other clinicians to remember? And I'll answer this too, when caring for patients of color during winter season. And it could be something we talked about, but you think is really important.
Yeah. I mean, I think we've talked about so many things, but I would say that one of the key things to really take away is that oftentimes, patients will come in and they'll come in complaining about the hyperpigmentation, but we must treat the underlying cause. So, we can't be so quick to just jump to treating the hyperpigmentation, even though, patients might be upset. They might be like, why aren't you addressing this? But we are addressing it. So really,
Right.
remembering that we need to treat the eczema or the whatever the inflammatory condition is first before we jump to treating the hyperpigmentation. And I think your patients will be, much happier in the end and thankful that they took the long road and not the shortcut to really get lasting results.
Yeah, that's such a good point because people might come in with hyperpigmentation because their skincare routine is too harsh because it's the middle of winter and they're doing so many things. I've definitely seen that where people can cause like this low grade uneven skin tone or hyperpigmentation of the lower face or on sensitive areas because they were doing too many different things that were irritating. And there's almost no margin of error in the winter. In the winter, your skin barrier is already compromised. So if you start using skincare that's really too aggressive, you really have no wiggle room like you would have had in the summer when you're oily and sweating. And so you have a little bit more of a barrier there. So that's a really good point when we think about managing hyperpigmentation to really make sure in the winter that you are using products that are really hydrating and not going to aggravate the skin. I talk about that a lot when I'm treating melasma. I always say I want the skin to be fast asleep, and you don't want that the you don't want their treatments to kind of aggravate their melasma. If they're too irritated, the melasma kind of I think can flare. So that's a really, really good point is really address the underlying cause for whatever skin condition you're treating. Make sure your patient is hydrated in the winter. And I'd say my winter tip would be that even in Miami, even if you're in it, because I think many of us who are listening to this podcast might not be in a traditionally cold winter climate, but recognizing that it's not just the cold weather, but the change in humidity that really causes the changes in the skin, and that we kind of have to be look on the lookout for that and on the lookout for flares and even diseases like psoriasis that we don't traditionally think of having seasonal changes can flare. And I think it's primarily due to that change in humidity and changes in the skin barrier that occur when the humidity drops. So I would say that my takeaway would just be keep in mind that even though it's not cold in the winter, may not necessarily be cold in the winter in a given area, the humidity drops everywhere, and that can really aggravate certain skin conditions like psoriasis, obviously like eczema. And so it's something for us to think about. So even though you're in a sunny climate, you can still have quote unquote winter skin.
Seasonal changes, yes.
Seasonal changes, that's it. Thank you so much, Dr. Obayomi, for sharing your expertise with us today. To our listeners, we hope you found today's episode informative. If you're interested in learning more about the work of the Skin of Color Society, visit skinofcolorsociety.org. Don't forget to subscribe to HCPLive's newsletters and follow us on social media to stay up to date on the latest in dermatology and more. We'll be back soon with another episode, so be sure to subscribe to Skin of Color Savvy on your favorite podcast platform. Until next time, take care and thank you for listening.